Welcome to POC Nurse. Let's do a ccrn question. And here is our question. A 68-year-old male with a history of heart failure and chronic kidney disease develops acute pulmonary edema. His ABG shows a pH of 7.29, PaCO2 of 55 millimeters of mercury, and PaO2 of 72 millimeters of mercury. What is the best initial management? Here are the answers. A. Start non-invasive ventilation. B. Increase FiO2. C. Administer intravenous diuretics. And D. Intubate the patient. And the answer is A. Start non-invasive positive pressure ventilation. So remember, it's talking about the best initial management. Why is this the answer? So NIPPV is the first line treatment for acute pulmonary edema in patients with respiratory distress. So how does it do this? Well, it helps reduce afterload. That is, it reduces the amount of blood coming to the right side of the heart. In doing so, it also reduces the workload on the left ventricle. So, what does this do at the end of the day? So, remember, if there's too much fluid in the left ventricle and the left ventricle cannot push it all out, that fluid backs up into the lungs. So, when there's less blood going into the left ventricle, there's less blood to back up to the lungs. So, therefore, what this entire mechanism does is it helps remove or push fluid out of the pulmonary system and into the circulatory system. So then, this way, it improves oxygenation and ventilation. The answer B, increase FiO2, is wrong in this case because remember, we're talking about the best initial treatment or management, and the first line treatment is NIPPV. Increasing FiO2 might help initially or temporarily, but it doesn't address the underlying pulmonary edema that's causing this respiratory distress in the first place. C, the answer, administer intravenous diuretics. It helps, but excuse me, it does not directly improve respiratory function. It just helps remove fluid from the system, but it doesn't address blood backing up into the lungs from a left ventricle that's unable to handle the amount of or the volume of blood coming into it. So, administer intravenous diuretics by itself doesn't address the issue, but it can be combined with NIPPV to improve the outcomes for the patient. But in this case, for this question, C is incorrect. D, intubate the patient. Now the patient gets intubated if NIPPV fails or the patient does not tolerate it. Sometimes the patient will keep taking off the mask because they don't want it. Sometimes the mask stays on, but the patient does not improve. The patient is retaining CO2 and there is no clinical improvement that can be seen. In this case, the patient will need to be intubated. Thank you so much for watching. Please like, share, and subscribe, and I will see you in the next video. Bye bye now.